But it's Tony Snell, 10 till 2, Kevin Dwala, 2 till 6.
Paul Beasley at breakfast. BBC Radio Merseyside.
22 minutes past 7 o'clock. A new high-tech fitness project has been launched to help patients at the Clatterbridge Cancer Centre NHS Foundation Trust. Patients waiting immunotherapy have the chance to get fitter and improve their chances of successful treatments through a partnership with the hospital and the university. The new pilot initiative offers patients a free digital smartwatch linked to a bespoke exercise plan designed by clinical exercise experts at Liverpool John Moores University, and it helps them to become fitter in the lead up to, during and after their cancer treatment. Well, Dr. Jess, Hale, a medical oncology registrar at the Clatterbridge Cancer Centre NHS Foundation Trust, that is a mouthful, isn't it, is leading the £40,000 project together with Dr. Anna Olsson-Brown, a medical oncology consultant in melanoma and a specialist in immunotherapy, which is being funded by the Clatterbridge Cancer Charity. Well, Dr. Anna Olsson-Brown is with us this morning, and I'm delighted to say good morning to you, Dr. Olsson-Brown. Let us just start with, because I don't know what this is, so I'll be honest myself, what is immunotherapy?
Good morning. So immunotherapy is a new form of cancer treatment that we've had only for about the last 10 years or so, that essentially retrains somebody's own immune system to manage their cancer and reduce down any cancer they might have. So it's a really exciting, massively, rapidly advancing area, which is open to many people with all different types of cancer, particularly starting in melanoma, but now available for at least 15 different cancer types. So it's really exciting, but we're learning as we go. And what we're trying to do is put as much support and service changes into place from the get-go to try and support patients who are having these treatments. And actually, Clatterbridge is one of the biggest users of immunotherapy in the country, so we're really well situated to help support patients while we're getting them through their treatment with these drugs.
And how much of an effect, I mean, I know this is an emerging field, you just said that yourself, but how much of an effect does immunotherapy have on patients?
It's revolutionised quite a lot of cancer treatments, for different patients. So, for example, in melanoma, we've gone from metastatic melanoma being a very poor prognosis cancer with a prognosis of a few months up to over 50% of people living for more than 7 years. So it's completely changed the landscape. And we really want to make sure as many people get the opportunity to have immunotherapy as possible. But we know that there are quite a lot of side effects associated with it, but also that the person's own immune system is an integral part of the treatment. So we're looking to optimise both people's own immune systems, but also try and limit the amount of side effects they have during treatment.
And Dr. Olsson-Brown, how does exercise actually help?
So exercise is useful for lots of reasons. One is that it really helps the people remain fit. It means they keep their level of fitness when you're having treatment that can actually reduce because you're tired and the effect of the drugs. So it actually helps you stay fit and active and actually tolerate the treatment better. But also we think that there are some direct effects of exercise on the immune system. It helps the immune cells circulate around the body and probably actually helps your body create more immune cells, which is what we want to do in this setting. We want those immune cells to be there to treat a cancer like it would do a bacteria or a virus.
And presumably this is not just physical, it can actually give a mental uplift as well.
Absolutely. And mental well-being is such a big part of experiencing going through cancer treatment is really, really hard, and it shouldn't be underestimated. So absolutely, I think there's two things. One is the fact that doing exercise we know helps mental and physical well-being, but also there's an element of autonomy there. Actually, people always ask me what they can do to help their treatment, and so actually having a program where they can engage and get more fit during treatment is something that's really exciting for us, and we're really excited to be working with John Moores to deliver this for people.
Now, just clarify this for me. Exercising to reduce tiredness. I and some people may wonder, how does that work? Aren't you more tired if you exercise?
So You're absolutely right. So exercise, when you're, after you've done it, you're feeling, weary because you've actually put your body through a workout. But actually, over time, you increase your stamina, you increase your well-being, you increase the endorphins you create. So there's lots of long-term effects. So you're right, short-term, after you've done it, you do need a rest, not unreasonably. But actually, over time, your levels of energy and levels of sort of physiological capability actually increase, which is exactly what we're aiming for in this patient population.
Now, I understand that studies have shown that getting regular exercise can actually cut your chances of developing cancer. Do we know why that is, Anna?
We don't really. I mean, I think that's true. I mean, some of the studies coming through, there's lots of things that can help reduce your risk of cancer. Not smoking and not drinking, having a better lifestyle, all help. It may be that there is an intrinsic relationship with the immune system, but we need to do a bit more understanding of sort of the processes of why it helps. But certainly having a fit and healthy lifestyle is a positive thing in trying to prevent getting cancer.
And Anna, tell us about the program that you create with patients, so they've all got their own personal program. What do they look like?
Yeah. So at the moment, this is very much a pilot. So one of the things we really want to do is try and understand what the best process for people is when they're on this program. But the idea is essentially that they will start at the beginning of their immune therapy. So at the same time they're starting treatment, they'll start this program. They'll work with an exercise physiologist to create a program for them, and then that will be delivered digitally over a period of months. And it will be adjusted to see to their needs. So they'll start with the program, and then as things progress, as they start experiencing it, it will be adjusted to see how they sort of manage it over time, and if they need less exercise or they need more, then that can be adjusted as they go through. And also as they get fitter, then theoretically we would be able to increase the amount that they're doing as well. So it's bespoke based on their own individual needs.
And do they have to go to the gym every day? I mean, how do you monitor them?
No. Not at all, no. They definitely, and in fact, they rarely have to go to the gym at all. It's about sort of home exercise. They get monitored sort of digitally. So one of the things that we've really changed over the time we've been sort of experiencing healthcare since COVID is that actually people don't need to come face to face all the time. There has to be an interaction is important, but they're managed both by the digital app and also by sort of phone calls and Zoom calls with the team that sort of support them through the process. So it's not really arduous for the patient. It's meant to be a really sort of something that they can adopt into their day-to-day life.
And finally, just before we let you go, Anna, how do patients actually get involved? Do they have to volunteer, sign up for it, or will they be approached by clinical staff?
So this is a pilot setting for patients who are having a particular type of immunotherapy treatment in melanoma, and they will be approached by our team during their consultation with us at Clatterbridge, but then they will sign up for it independently. Our aim is, once we've completed the pilot, if it looks that this is actually helpful for patients, that we will expand out across different patient groups who are looked after at Clatterbridge.
Dr. Anna Olsson-Brown, thank you so much for joining us this morning. Thank you for all the work that you're doing at Clatterbridge as well. Dr. Anna Olsson-Brown is a medical in immunotherapy, and that project is being funded to the project of the £40,000 by the Clatterbridge Cancer Charity. Great.